Okay, before we get started, and while Erin is pulling up her slides, I'm just going to give a quick introduction. So hi everybody and welcome to this workshop of the Virtual Pharmacy School Fair. My name is Gabriella. I'm from AACP and I'll be moderating this session. We'll get started with today's session in a moment. Coachability, a prescription for success. But first, a few housekeeping items. Although you will be muted the entirety of the webinar, please feel free to ask questions in the Q&A window throughout the webinar. We'll try to save some time at the end of the presentation to address those questions. And if there are any questions that we don't get to, speakers should be available in their booths during the expo hours today, which are from 5 to 7 p.m. Eastern Time. So we highly encourage you to visit their virtual booth at that time. And lastly, the presentation will be recorded and available immediately afterward in the Sessions tab. So now I'm going to turn it over to our speaker to get started.
All right, well, thank you. My name is Erin Rainey. I'm a pharmacist and a professor of pharmacy practice at Midwestern University College of Pharmacy in Glendale, Arizona. And I'm really pleased to be here with you today to talk about a concept called coachability and how that fits in with your success as a pharmacy school candidate and also throughout your career as a pharmacist. So I'll start with our learning objectives. Today, I'm going to kind of dive into the concept of coachability and how that really relates to preparation for success in professional programs and lifelong. And we're going to spend some time talking about assessing our coachability characteristics and also how we can cultivate coachability through some easy steps. So let's first start talking about what coachability is. And when we think about coaching, I think we always consider sports first. It's very common to think about coaches as part of an athlete's life cycle, whether it's starting in elementary school or we're talking about an elite athlete who is an Olympian. And we imagine that a coach is essential to their development, even when they are an accomplished athlete. If we saw an NBA basketball game, we would be surprised if there was no coach on the side of the game giving feedback and guidance for success. What we don't often think about with coaching is a coach for other aspects of development and in our careers, in our professional life, maybe even personally. But coachability is something that pertains to all aspects of life, even those of us who are not athletes. So from this definition, you can see that coachability is an individual's willingness and ability to seek, receive, and act upon constructive feedback to foster self-development and enhance performance. And that can be across sports, as I mentioned, but also in business and in our professional life, as well as in our educational time. And so I'm going to be really focusing in on coachability and how it pertains particularly to getting into pharmacy school and then in our journeys as pharmacists as well. So why does coachability even matter in pharmacy? And you can imagine that someone who is dedicating their life to the profession of pharmacy will need some guidance along the way, but there's some particular components that really link well to coaching. And I'll start on the bottom left of the screen. We can see that joining a profession, whether it's nursing or a physician or pharmacy, it involves developing your professional identity. And with that comes role modeling. And you will seek out role models in the profession to determine who you will be and what you will look like as a pharmacist. And you'll also serve as a role model to others. And as we dive more into coachability, you'll see that in order to really gain information from a role model, you have to be coachable. So that's one aspect. Another is that while didactic education and sitting in the classroom to develop your pharmacy skills is part of every pharmacy education, we also dedicate a lot of time in the clinical environment and training on the job. And that involves pharmacy school training as well as beyond after graduation. And that type of training is something that involves a lot of feedback, and that could be on a daily basis or weekly or monthly or annually. Feedback is essential when you are committing to lifelong learning on the job. And so that is another reason that pharmacists who are coachable are really going to have greater success. In terms of lifelong learning, as I mentioned already, the clinical training that we have, but also considering medical advancements. When I became a pharmacist 30 years ago, there were quite a different number of medications on the market then. And in order to keep up with that, you have to learn how to teach yourself, but also seek out others who have that expertise and be in a coachable mindset throughout your career. That never stops. And that just comes with joining a profession that is constantly changing and advancing, like medicine, pharmacy. And then finally, we can't practice pharmacy in a silo. We need to work with interdisciplinary teams. Other professionals are essential to patient care. And when we are kind of working cross disciplines, that's another moment where coachability matters. We learn from each other, and it's important to be open and learning all throughout your career from other professions. So when looking at what makes coaching successful, you can imagine that the qualities and strategies of a coach are very important. In fact, when we think about coaching in sports, it's quite often that we see in the news media who is being hired as a coach or fired as a coach of one of our favorite teams. And we really hope that that coach's skills can contribute to the success of the team. But when looking at what determines successful coaching relationships across time, the actual strategies of the coach are determined to be kind of the smaller piece of the pie. The bigger components that determine success are really related to the relationship building between the coach and the learner, and then also that readiness of the learner to be coached. So if you see that 40% of the pie is how ready that learner is to take in that coaching. And that's exactly what we're talking about with coachability. As you are planning to apply to pharmacy schools and be a pharmacy student yourself, we'll see how important it is to set the stage right now. So we'll dive into what makes somebody coachable and what attributes mean that someone has coachability. And I like this quote from Soren Kierkegaard, who's a Danish philosopher. And he states that life can only be understood backwards, but it must be lived forwards. And when we think about kind of that quote of hindsight is 2020, we're journeying forward every day, kind of blindly. And if we have coaches along the way who have expertise that might have lived that path before us, they are able to give us that guidance as we navigate kind of the unknown. And of course, when you look back after 10 to 20 to 30 years, and you recognize how far you've come. So let's look at some characteristics and qualities that make someone coachable. First of all, we'll talk about the components of coachability. And you can see there's 6 boxes here, and I'll start at the top with attentiveness. And a lot of these qualities just make a great person, right? Someone who is ready to be in the moment with what they're doing. Being attentive, self-aware, and aware of others is essential if someone's coachable. You can imagine if we were an athlete, maybe an Olympic skier, and they weren't attentive to the moment, but they were focused further on in the future, then that everyday practice with the coach won't take on the success that it could if they really are kind of going through the motions of each day with that intention. The second box is willingness to learn, and this should be obvious, but a lot of times when we think about coachability, we all come with a different layer or confidence level, and in some cases there might be different levels of willingness to learn. Taking on that responsibility is very important for coachability. And because coachability and coaching requires a lot of deliberate practice where you receive feedback and then you do it again and again and again. And imagine the NBA basketball players shooting baskets, they never stop. That's not something that even the experts don't do on a daily basis. That requires persistence. This is part of your life as a pharmacist and after pharmacy school, but also resilience, because the feedback that you get as you're being coached can actually take some moments where you are navigating feedback that might be constructive, might be on the negative side, and to be resilient through that and know that you can come through on the other end. There's 3 boxes related to feedback, and we're going to talk a little bit more about feedback as we go. But the first is to seek feedback. And feedback might be part of a process that you're passively receiving because you are a student, for instance, and you'll get some feedback automatically. But feedback seeking means that you go above and beyond to ask for feedback, and that is one aspect of it. But just seeking it doesn't mean that it's easy to be receptive to it. Receptivity is a whole other ballgame. And when we know we're open to feedback, that is where then we can kind of navigate what that feedback is and decide if we're going to implement it. So receiving feedback doesn't mean we have to implement it. And that's another key characteristic of coachability is knowing when to implement feedback and when to not, if it doesn't make sense for your particular situation. Now, kind of building on those components, if we think about if somebody is coachable, there's some general characteristics. Some of these are similar to what I just spoke of. But generally, if we're looking at a pharmacy school applicant and whether or not they're coachable, we're looking for a student who has that level of self-awareness that they can reflect upon their goals and their past experiences and what their improvements are. And then they also are approachable, just navigating that relationship building with the coach, receptive to feedback, as I mentioned. And then there's a high level of curiosity that makes somebody coachable. Really being able to step up and look at a situation and say, oh, I think there's something for me to learn here. Gratitude makes that relationship building and feedback seeking as well as receptivity something that's most successful. And then there's that accountability piece. And we all have a role to play in this coaching scenario as faculty and preceptors for pharmacy students, as well as the students themselves. There's a high need for accountability on all sides. Follow through is essential as well, so that if there is feedback provided, that then there's some change made and then additional feedback kind of going as a cycle and a process over time. And then what could be pretty difficult is finding a really nice balance between confidence in what your skill set is, as well as humility, knowing that no matter how long you've been a pharmacist, in your first year or your 40th year, there's always more to learn and things are changing constantly. So we're going to meet Alexis and Jason and kind of talk about the coachable zone of these two students who are starting their first year of pharmacy school. So you can see that Alexis is very excited. She knows that she wants to complete a residency after pharmacy school. She wants to work as a critical care pharmacist and is very excited to start her program. Jason's also excited. He has experience as a technician in the hospital. He knows he recognizes drug names easily and he's ready to go. And what we're going to do is kind of work within these two individuals and think about the coachable zone and how important it is to be coachable with this spectrum of low confidence to overly confident and finding that balance in between. When someone's overly confident, they're not open to feedback and they might not even seek it. And then being able to transfer that information into action, that becomes pretty difficult. However, when someone's not confident enough, especially that seeking feedback is difficult, and then even feeling like they can make a difference and make a change can be hard for someone with very low confidence. So as I talk through these scenarios, I want you to think about it for yourself. If you're in the coachable zone right now as you start your pharmacy school applications. So if we want to be in that coachable zone, there's 4 steps that have been proposed. To develop a beginner's mind, take ownership of learning, become good at reflection and recognizing blind spots and being present. And these map back to many of the things I've talked about already. So let's first talk about that beginner's mind and we'll go back to Alexis. And, she really is excited about being in an intensive care unit and being a critical care pharmacist. And she's starting her first year of pharmacy school taking a non-prescription drug class. And this is common in all pharmacy schools, learning about what patients can buy over the counter in their typical community pharmacy. She is feeling like that class is a waste of time. She knows she doesn't need that information in the ICU. And a beginner's mind is something that we can activate at any level of our expertise. You're 1 in pharmacy school and you're 40 in practice. We can always take on a new experience with a beginner's mind. We know that bias from our past experiences can prevent us from being open to new possibilities. And really switching that into curiosity and feedback is the way to activate the coachability side of this. So instead of that thought for Alexis, she might say, I'm very interested in how a critical care pharmacist might need this information. It doesn't seem obvious to me, but I would like to find out. And that just opens up that opportunity. And in fact, every pharmacist needs to understand medications across all transition settings, and knowing that there's many over-the-counter products that are also available in formulations that are used in the ICU. Not only that, but our patients who are in the ICU are also actively using medications when they live at home, and understanding their medication use across the board helps facilitate very good care in that acute situation. So we're just looking at switching to a beginner's mind. In order to do that, being coachable involves having a growth mindset. And you are likely familiar with this term, but someone with a fixed mindset might feel like their skills are pretty set. They were born with certain strengths and can't really change beyond that. If they do fail at something, they see it as maybe a judgment on themselves or others, and pretty likely to stay with things that are comfortable. When getting feedback, they might feel more defensive. And that really is a contrast to someone with a growth mindset who knows that over time skills can be developed and failure might be part of that. Failure is a form of feedback, and so that growth over time is possible. Someone with a growth mindset is more likely to step out of their comfort zone and really embrace feedback. And that's a growth mindset it's easy to see on paper. It's not something that's always easy to activate on a daily basis, but people who are coachable and someone who's desirable from the standpoint of a learner in a pharmacy program really would have that growth mindset to start. And so as you think about your experience today, thinking about your growth mindset is really key. So let's talk about taking ownership of learning as that next step. And we have Jason here, who's worked as a hospital technician, really kind of aware of his knowledge and recognizing that learning is infinite and there's always an opportunity and a responsibility to put in that work. Remember that the abilities of the coach, like your professor in class or your pharmacist that you're working with on your rotations, their abilities are only a small portion of your success. That commitment to learning and that growth mindset is really what makes it successful. So if Jason is feeling very comfortable with drug names, instead of being frustrated if those are being repeated in class, he can say, well, because I know all of these drug names, now I'm ready to learn mechanisms of action, the side effects, how to counsel patients, and how to monitor, and really celebrating that knowledge as a foundation for more knowledge rather than an end point, and kind of closing off that opportunity for further learning. The next step is reflection and recognizing blind spots. And we know that coaches are meant to support self-reflection. We don't have an expectation that a coach would teach us how to play tennis by us sitting on the side and watching them play. They would support the opportunity for learning. And that's what we do in pharmacy. We create opportunities for students to learn and self-reflect. But that requires some vulnerability. And anytime we look back at ourselves and know that there's more room for growth, that can feel like that kind of impacts our confidence level sometimes. And especially when we're given feedback, we can talk about how that feels to hear those words. Can I give you some feedback? I know for myself, when I hear those words, I think my body automatically tenses up. I get a little bit of my stomach turns a little bit. And I think it's human nature to get a little bit on the defense, ready to hear feedback. And that's something that we work on lifelong. But that feedback opportunity is really an essential part of that coachability. So let's talk about why that is. And Stone and Heen have a great book called Thanks for the Feedback. And it's really talking about how we can align ourselves in a way to receive feedback well. And part of the reason we go into that defensive mode sometimes is that there's different types of feedback, but we don't know what's coming at us sometimes. There's forms of feedback that are pure appreciation, and that's amazing. You're told that you did a great thing, very encouraging. But then that's in contrast to evaluative feedback, where you're really being measured against certain expectations and you're being told how you measure up or not to those expectations. And both of those are not an example of coaching. Coaching feedback is intended for growth and improvement. And in that case, that's really important to consider as you are receiving your feedback. So as we look at receiving feedback effectively, there is a process to this and something of an art as well, where we seek feedback and then we have an opportunity to respond with reflection and action. And as we learn over time, seeking feedback and receiving it does mean just listening openly and clarifying. But it doesn't mean that we have to act on that feedback. And we do have a sense of control that feedback is not about closing off the opportunity at all. It is about listening, determining how much that feedback matters, and then reacting in a way that's positive for yourself. And that's where that self-awareness comes in. So as a pharmacy student, you get lots and lots of feedback, and recognizing how you react to that and how you're able to fit that into your goals. In some cases, choosing not to follow the feedback is something that we would like to see in students to develop over time, and that's part of coachability. And then finally, being present in the process. There's lots of destinations. You can focus on graduation, starting pharmacy school, being licensed as a pharmacist. It's easy to think forward and not think of the day-to-day, but someone who is coachable is really going to kind of see each day for what that brings, even if there is a bigger destination in the far view. We need to think about what opportunities lay before us just in the next few hours of each day. Now, how would someone assess you for coachability? And sometimes we see that happening in interview questions. So round out the presentation, I'm going to talk a little bit about how things might show up as you prep for your pharmacy school interviews and some things to think about. If I was interviewing someone I was looking for coachability, I might ask a question like, describe a time you received feedback you didn't agree with initially. How did you handle that situation? In that case, I would be looking at whether that student could describe when they've had feedback, if they sought it out, how they communicated, if they can manage conflict. A question like, how do you approach a new responsibility that you've never encountered before? Many times you might think it's great to answer that you've done everything on your own, you never needed a help. But actually in a caring profession like pharmacy, where you are needing to be coachable through a lot of training over time, we need you to ask for help. We need you to know that when you've never encountered something before, you need to be curious but humble and know how to ask for feedback and assistance. Describing a skill you've recently tried to improve. How did you determine the best approach? Are you able to describe how you looked for someone with expertise? What resources did you seek out? How did you know your own limits? And when did you know that you were beyond your own knowledge so that you could then improve with that coaching? That really tells us that you are ready to interact with the pharmacists and the preceptors you'll be learning from over time. And another one, provide an example of when you asked for help to complete a project. How did you determine that you needed that assistance? Again, that self-awareness and humility, knowing where your knowledge ends and what you can seek out as far as assistance to improve even. These are nice, subtle questions that might come up. Here's a few more to consider in terms of examples when you learned a new skill, or how did you decide to follow feedback advice if you received it? Don't always have to follow it. That could be interesting as a talking point. Explaining an error you made and how you resolved it. And then example of a situation where you applied knowledge you gained from someone else. Again, it's not always about being able to take on everything yourself and having it all figured out. We want to see that you're coachable and that you seek out feedback and coaching from others, even before you started pharmacy. So as we round out the presentation, just as a reminder here with coachability, it can be developed. We're not born coachable. These are skills that we can build over time, and it really just requires a growth mindset, that balance between confidence and humility. And we know that coachability ultimately will help us provide the best patient care and be the best pharmacist possible for our patients. So thanks for your attention, and I'll go ahead and open it up for questions if there are any.
We have not received any so far, but I'll give it another second, see if anybody has
Okay,
some last minute to type in.
great, thank you.
I think we'll wrap things up today. Thank you so much, Erin, for your presentation, for your time. If attendees have any other questions, they can visit Erin's booth later during expo hours, which are 5 to 7 p.m. Eastern. But thank you so much, and everyone else enjoy the rest of the virtual fair.
Right, good luck everybody in your application process.